My understanding that the Republican proposal to remove the low-income discount rate from the public benefits into the budget, I don't see that in here. I don't want to belabor the issue about the process. We've already done that, but just to confirm that I'm correct, that is not included in the budget through you.
Representative Walker.
Through you, Mr. Speaker, this is not an energy bill. Through you.
The reason, since I got here in 2021, we've sort of had some money to do things. We had ARPA money, we had all the COVID money, et cetera, and the state was kind of moving in a pretty good direction. Things have changed a bit, right? This budget cycle, I think, has probably been hard on everybody in here. And, it makes it a very, very difficult evening. It makes it a tough vote. And frankly, it makes it a tough process. I'm a father, and two of my colleagues in the last couple of days on the other side of the aisle are moms, well, many of them are moms, but two of them in the last couple of days have noted that they miss their families and, trying to balance being up here. One of our colleagues I know had her daughter come here from her senior prom, and it's a balance. And many nights, like many of my colleagues, moms and dads, lay awake at night, and I struggle with difficult decisions, right? So I want to be at every one of my kids' games. I want to be home and playing basketball and stuff with them. But if I'm home all the time, I can't very well support them. I can't feed them. I can't put a house over their head. I can't pay for their college education, put clothes on their backs. But if I'm at work all the time, it's like I'm not there. And it's a struggle that I think all parents endure. And I know my parents are watching right now, and I know for years they went through that, and they got through it, and I hope I make them proud with what I do. But these are difficult decisions for us to make, much like we make difficult decisions in our home of balancing, when I need to be there and when I need to be at work or when I need to be here. We make tough decisions at home and one of my friends in the gender discussion said the genders are infinite. Well, money is not. Unfortunately, money is not, and I think we can all agree with that, whether it's the state of Connecticut, whether it's the federal government, whether it's a business or at home. I wish money was infinite. I want the world for my kids. I want to give them everything, but I can't. And everybody who comes to this chamber wants to give the people of Connecticut everything, but we just can't. And we have to make difficult decisions here. I got sent here by 25,000 people that live in southeastern Connecticut. And over the last 16 months, so many of them, more so than any other issue, have called me and said, Greg, the public benefits in my energy bill are killing me. I sat in the living room of a Vietnam veteran who's disabled, who doesn't have any legs, and he's in a wheelchair. He's got his grandchildren living with him to help support the bill so he can stay in his home. And he's complaining about the benefits in his electric bill. When you're a state representative, as you all know, you get these calls from people, and you want to do the best that you can for everybody, but the resources are limited, and I think that's the trouble with this budget, which makes it so difficult. I don't think anybody on either side of this aisle is inhumane. I think everybody wants the best for everybody in Connecticut, and we're trying to determine who do we prioritize, where, and with what. And that's the struggle. Mr. Speaker, two of my colleagues earlier have talked about some budgeted funds for health coverage, insurance coverage for individuals without qualifying immigration status, totaling $116.3 million over the biennium. What I would like to see happen in doing the work that my constituents have asked me to come to do is to reallocate that money, Mr. Speaker, into paying down the low-income discount rate part of the public benefits program. And the reason, sir, that I chose that particular program of the many in the public benefits is because public welfare is a function of government. It's part of what we do. We pay taxes, we pay fees, they're hidden here, hidden there, sometimes they're a little bit more overt. And part of what we do is we take care of folks who can't care for themselves. It's part of what we do. I think it's very important that certain individuals in our state that have been veterans, that have been longtime taxpayers and residents of the state of Connecticut, have the help that they need to pay their electric bill. Mr. Speaker, quite simply, it's a very similar version to two previous amendments as far as the reallocation of the budgeted funds for individuals without qualifying immigration status regarding prenatal, postpartum, and for children age 15, amended then to under age 12. It still allows money for emergencies, will remain in the budget, but it reallocates that $55.1 million and $61.2 million respectively in year 1 and year 2 of the budget to the low income discount rate or LIDA program that we have to fund to help fund payment for those less fortunate to keep their energy bills going out of the state budget, because it is in fact a function of government as opposed to the backs of ratepayers. I move adoption, Mr. Speaker. I ask when the vote be taken by roll.
Question. Will the clerk please announce the tally?
House Amendment Schedule F, total number voting 144, necessary for adoption 73, those voting yea 47, those voting nay 97, absent not voting 7.
The amendment fails.